My name is Trish Scanlan and I am a children's cancer specialist.
My name is Anna and I'm one of the student leaders of Threads of Kindness.
And my name's Jhalak and I'm one of the 3 student leaders of Threads of Kindness.
I work in Muimbili Hospital on the ward. I also work in Tumaini La Maisha, which is a children's cancer charity that I'm one of the founding members of. I also work in Ireland as the interim director for global health, and I am the medical director of a children's charity which helps children in Gaza.
We did not create this charity. It was originally created by previous students in previous years, and so now we crochet bags, bracelets, amigurumi, toys, hats, blankets to provide comfort for children with cancer.
So one of my early jobs as a very junior doctor was in paediatric oncology, and the thing I loved about working in that field is you get to know families and children really well because they are with you for months and months and months at a time. And then when I came here, I came at it just a perfect time. It was a time where things were beginning to happen for paediatric oncology, but hadn't really yet started. So you can group all of the challenges of treating childhood cancer in Tanzania with one word, which is poverty. Tanzania is a really beautiful place. The people are extraordinary. I love working here. It is economically improving as time goes on. There's still a huge amount of poverty. And that leads to so many different problems. It leads to delayed presentation, and that's because sometimes it's because the children and the families live so rurally, can't even afford the bus fare to go and see what's wrong with their child. They can't afford the simple tests that make the diagnosis. They can't then afford to pay for the transfer to the next hospital that might be able to treat the child. They can't stay because they can't afford to be away from work with their child. I would round with one of the other doctors, which means that I would see every single patient. And we would also then do the outpatient children that would come in, we would see them. Then we would do procedures, which are lumbar punctures, which is where you stick a needle into the back of a child to give them medicine or to check if they have any cells they shouldn't have, or bone marrow tests, where we stick a needle into their hip bone, or any other procedures that we would need to do. We pay for the chemotherapy for every child in the country, and the way we do it is by supporting hospitals to treat the children more locally and then sending them boxes of drugs appropriately on a weekly basis and taking samples in the other direction and processing them for them. And in that way we try and access more and more children. And so what I'm trying to do is reach more hospitals, connect them together so that even if they're not a treatment hospital, even if they're just a suspect and stabilize hospital, that they then know how to quickly transfer a child to a treatment site. We still think that we're only hitting about 25% of what's out there, and that children are still being stuck in smaller hospitals. So we need to get to more and more and more of these hospitals, connect them into our network and help them transport children to higher centres for diagnosis and treatment. And that's what I'm concentrating my time on at the moment.
It's pretty much really a collective thing, but also really individualistic. Us personally, we can't solve these problems because, we are not these children, we're not their doctors. But what we do understand is how important support is and feeling comfortable.
Our message is just that you are not alone. There are people who haven't even met you, who care and want to support you. And also, we just want you to know that your courage and your resilience is really inspiring.
So cancer was a very scary word. I know that it stops people dead sometimes and they really think cancer means death, but it doesn't. I have had relapsed breast cancer, which means I've had it twice. But the last time I had it was 10 years ago. I'm perfectly healthy now. And the majority of people who have cancer get better. But I think the main message is cancer is curable. come and we will treat you. People ask me who I am and what my role is, and I've come up with this glib way of saying it, but I actually quite like it, is that the children are the pearl, right? The child going back healthy is the pearl. The oyster is all of the medical teams that look after the children. The shell is all the donors and all the supporters and everybody else. But in order to make the pearl, you need an annoying grain of sand. That's my role.